All right, welcome to Health Second Opinion. Dr. Chad McDill here, live from the Chattanooga Trenton area here in Dade County, and just really excited about yet another week of hopefully bringing you some principles and some truth to allow us to have again some confidence in back to school healthy. If we're looking at things long term, then we understand that the not only is the key to opening schools, which thank you Dade County for getting things open and started today. I love the way that we're trying to handle things and headed in the right direction. And I look forward to Hamilton and trying to get on the board and doing things in a better manner. And I really want to be a part of empowering people to be able to feel confident and secure and really look at, well, when we answer this question, which is, if we're going to keep schools open, we're going to keep the economy open, then we have to have this plan, because what if there's a second wave? Well, we're kind of in it, right? And so what if the wave continues? What's your plan? What are the principles that you're going to build your plan on from a health perspective? And I want to start out by looking at, so many people, we reference the way that other countries have handled this, and we're looking at how we are in comparison to that. And so I'm basing all this research. I want you to look at the 2018 American Health Rankings. This is done by the United Health Foundation for the last 30 years. And it's an annual post. Again, 2018 Annual Health Rankings, United Health Foundation Annual Report. This is also going to be brought to you out of the OECD, which is the Organization for Economic Cooperation and Development, is a group of 37 countries around the world that are doing just that, economic development and cooperation. And then it's going to be out of the World Health Organization's stats for last year. So we have to look at what is the principles that you're going to build on, and are your forces and the things that you're working with, are they constructive or are they destructive? Do you believe in treating disease, or do you believe in building health? There's Dr. Fred Barge, who spoke about the fact is there's really no such thing as darkness. It is simply the absence of light. And when we think about disease, it's not that there's no such thing as this disease. It is the absence of health. And as we degrade health, the room for more disease is built. And you have to decide which one makes more sense to you. Is it waiting for something to become destroyed, your health, or are you going to build health and invest in your health? Because when we look at things, of the top 10 worst death rates countries from COVID, one of the two major stats that stick out are the fact that of the 10, 8 out of 10 have some of the highest, or the highest, world's percentage of overweight and obese population. We know this to be true, right? It seems like all around the world, one of the biggest cofactors, one of the biggest comorbidities is that they're overweight or obese. They have the highest populations thereof. 7 out of the 10 with the worst death rates for COVID, 7 out of the 10 have the highest rates of diabetes in the world. So when you put these two comorbidities together, then you look at Canada. Let's compare ourselves to Canada, somebody around the world, everybody's saying is doing a much better job in the way that they're handling things. Out of the western part, Alberta, this gentleman, he was the minister over there. He spoke to the fact that, not being callous, he said, but yet the fact is that the majority of the people, approximately 70% of the deaths from COVID were over the age of their average life expectancy, which is like 82. So when they looked at this is in the western part, Alberta, that 70% of those who died from COVID were 79 and older. Between ages 70 and 79 were 22% of the deaths, and only 5% of the deaths were from age 60 to 69. And 89% of those who died had two or more comorbidities. Two or more comorbidities. So when we look at all of these things, and you look at the fact that when we look at the worst health-related countries, death rates are high. When you look at the biggest comorbidities that go along with this, it is diabetes and obesity, or being overweight. And so when we look at these things, I want to bring this to a kind of a factor for if we're going to be looking at this from fixing any problem. And right now we're keeping schools open, we're trying to keep population healthy. So the number one thing is to state up front that this is about staff, not students. And that is for middle school and younger, about 99%. But then when you get up into high school, the more that there are these comorbidities that have been there long enough to build systemic inflammation, then these things, they start becoming more like adults. And so perhaps there's some things that need to be going along with staff versus the students. Because when we look at this, the reality is that the reason is that the staff is more unhealthy. The staff has these stats. When we look at this, we'll go again. This is from the Organization for Economic Cooperation and Development, in the fact that when we look at the United States, right from the beginning, I want to start right from the beginning. Infant mortality rates in the OECD, United States ranks 33rd out of 37 countries, and has a 75% higher infant mortality rate than 20 other countries. Maternal mortality rank is dead last. We rank 37th in maternal mortality. We rank 33rd in infant mortality. When we flip this over and we look at the fact that, again, going through this, more than any other OECD country, Organization for Economic Cooperation and Development, that's 37 countries around the world. The U.S. spends, we've seen a 17% rise versus a 9% rise in healthcare costs, and that our healthcare is 17% of our GDP. But life expectancy over the last 5 years has fallen, and it's fallen worse than any other OECD country and OECD. Then because they're citing this, and again, this is not my opinion, this is from the 2018 American Health Rankings, United Healthcare Foundation, in comparison with the OECD data. They looked at the fact that 43% of our children are now considered overweight or obese, despite the fact that alcohol and smoking rates have dropped and air quality has performance has improved. We're still seeing a decrease in life expectancy. Practicing doctors is declining while practicing nurses is going up. Between 1970 and 2017, there was the lowest amount of life expectancy increase in the United States versus any other country, these 37 that are in the OECD. And one of the reasons they cited was the opioid crisis and an 80% increase in deaths since 1999. And this is a quote: unhealthy lifestyles and are the most modifiable risk factors, including poor diet and sedentary lifestyle, to the reason we rank so poorly. And so again, you know, right from the start, if we're going to fix this, and any other country who's looking to fix this problem has a healthcare problem and a lifestyle problem, and the world itself has seen this massive increase in obesity, being overweight, and in diabetes. These are the trends around the world. It's just the United States is leading the world, and therefore the reason that this is such a major mind thing for you is to ask yourself the question: should we expect better results in fighting this virus? since we're one of the sickest industrialized countries on the planet, if the health of the general population is the lowest, shouldn't we expect the health performance in overcoming another challenge to our health to also be the lowest? Not just in, and I don't want to deal with the politics here, and I'm not talking about who's handling what. What I'm saying is, in general, the playing field is extremely low on average from a healthcare status. So if we want a lowered death rate and we want a lower infection rate and we want to keep our schools open, then we have to focus on building health in the population versus waiting for them to get sick and treating disease. And we've acted like that this is not possible in this crisis mode, and that we're up against a time clock, and yet we're like 5 months in. And in 120 days, I can completely help someone change their entire blood profile, their lipid profile, their cholesterol profile, their inflammatory marker profile, their body composition. Everything can change in 120 days. And so if we're looking on into November, when we expect things to really start to decline, or, due to many reasons, then you have to understand we've got time. And in the meantime, no matter what your focus, you have to make a choice. Are you going to buy fear and become inert, or are you going to invest in your health? What are you going to do to be one of the people who is in the 97% of recovery? What are you going to do to be one of those people who ends up being in the age group, ages 60 and older, that are being affected? In all reality, most are in the 70 and older. Then what are you going to do to reach that with less than 2 comorbidities? Because as we saw in Canada, who've been commended with doing such a great job in handling this, that still 89% of those people who were affected had at least 2 or more comorbidities. Sorry, obviously needed to have a sip of water because I'm starting to get tongue-tied. So when we look at these things, those 2 comorbidities are diabetes and obesity. Those are the number ones across the board. So what are we going to do to limit those or to minimize those in you? If we are going to start to build up our staff and we are going to keep our schools open, and that's what we all want, we want to get back to normal and not a new normal. This is our new normal. That's one of the most infuriating statements that I'm hearing now across the mass media is that new normal. What are you talking about? Then that's admitting defeat, and that's admitting that this is just going to become this new standard of doing things, when in fact it is going to be the new normal if we continue to practice what insanity, by Albert Einstein, which is doing the same thing over and over and again and expecting a different result, which is that we are going to throw more drugs at it. We're going to have more vaccines. We're going to have more things going on that are outside in, that are about fighting disease versus building health from the inside out. And as long as that is your model, and as long as that is our country's model, then we will continue to see a decline. We will continue to see this thing mushroom. And the only way to deal with producing health is to do more healthy lifestyle habits. Period. And if we continue to stay on the couch, and we continue to eat more sugar, and we continue to think only of negative things, and we continue to keep our stress levels high and our blood pressure high, and we continue to do all these negative things, then we should expect things to get worse. Why should we expect anything different? But if we can change the focus, America, if we can change the focus and get back to building health instead of fighting disease, then we reduce the comorbidities, namely the 2 most deadly in this instance, which is, again, diabetes and heart disease. And we begin to win the battle by changing the breeding ground in which this virus is trying to affect. And if the internal environment of our bodies is stronger and our immune systems are better, and we have reduced obesity and reduced heart disease, reduce diabetes, reduce cancer rates, and we fight the things that are tearing us down, then innately our bodies will thrive and we will become part of the 97%, and it will become 98% survival and 99% survival and on and on and on. And so you have to understand that, no, as a matter of fact, you don't. You can make a choice. You can totally disagree with me, and you can go to, once again, the 2018 American Health Rankings, United Health Foundation annual report. You can go to the Organization for Economic Cooperation and Development, and you can go to the World Health Organization, and you can look up these statistics, which I did all morning, and you can do this for yourself, which I highly encourage you to do. And then I will go ahead and summarize that for you, is that this is the only plan. This is the only way to get back to not just normal. I'm talking about better than normal. How would we like to finally have some hope? How would we like to finally have something to think positively about in our future as a country? Because one of the biggest things that we're in, the most viral thing right now, is fear. Right now, the most viral thing is the fact that everyone is in complete inertia and waiting to react. Instead of being proactive, most people are reactive. And so when we look at these things, how are we going to change that for you? What's the next step? Well, identify yourself. Are you overweight? Are you obese? BMI 30 or over for obesity, and anything over 26 for being overweight. So are you? Do you have diabetes? Do you have other underlying comorbidities? If the answer is yes, then you are in more of a hurry up than other people. But we're all wanting to build more health, right? Would you like to make it to age 90 with no comorbidities, and the only predisposing thing for you to be dying from is old age? Right? And I can hear someone in the background right now, this statement that I've heard before, from I think it was Sanford and Son guy, who said, well, I sure would hate to end up dying of nothing. So well, how about just dying of old age? Wouldn't that be great? But my point is, folks, we have the time. We have the time. And if we want to keep those schools open, we have to get started today. Yesterday would have been better. A year ago would have been better. But yet, now's the time. And so Max Living in the 5 Essentials is the best healthcare system available to help us reach these goals. And that's why I'm a part of it. And that's why I've dedicated my life to it. That's why it's allowed me to lose 40 pounds. That's why it's allowed me to continue to function at a very high level, which if you were following on Facebook, you saw that despite an 8-month ago shoulder surgery, that I'm still able to do 40 push-ups in a minute. And, I see all the squat numbers, and I wasn't able to do pull-ups this year. That'll be next year. And so you can see all the ways that I'm measuring my health. And then you can, if I had enough time, I should post my blood profile sometime and let you take a look at these things and say to yourself, you want this or something better? And then how are you going to get there? So it's the 5 essentials. Number 1, mindset. Tune in, tell your friends. Make sure that you're tuning into positive things. We need to start building faith. We need to start talking about this around the dinner table, which is, what did you do today that made you a healthier human being? Well, I gave somebody a hug. I told somebody I loved them. I was appreciative of the things that I have. I had gratitude, and then I meditated. I prayed. Whatever your things are that you can latch onto and create better habits with. And then you can focus on the positive, which is, saying to yourself, even if I was not perfect today, which none of us are, right? Then what did I do that was positive? And how can I give myself some kudos for that? And this is one of the hardest things for me. I mean, you could ask my wife, man, got home from work yesterday, and we had a new record of patients in the office. We're very proud to have seen more people in a single day yesterday than we ever have before. And so cool. But yet I was thinking about some of the things that I didn't do perfectly and how I could have spoken nicer and better and more effectively to some of the people who were here. And that was my mode. That was my mentality. And so when I saw that, she helped me refocus that. Well, same for you. On a day-to-day basis, how are you refocusing your mindset to stay positive and to build some faith and some hope and some love? Number 2, how's the brain-body connection happening for you? When was the last time you had your spine checked? Are you subluxated? Do you even know what subluxated means? Do you understand that all of life and your existence is experienced in the brain, and that chemical cascade and of all the rest of your body chemistry is controlled and coordinated through the central nerve system? And if that's compromised, then so is the rest of your health. And you can treat everything out here in this body of ours, and then you can continue to use drugs or wait till it gets bad enough to cut it out, or you can do all of these things. And, I'm not saying in medicine, thank God for it, in emergency and in trauma cases and in all of these things, thank God that stuff is there. But in promoting health, it's life stealing. It's not life saving, it's life stealing, because it's telling you to wait till you're destroyed to do anything about it. Instead, health promotion is the only way to go, and that's chiropractic, and that's not health, that's not medicine. So when we look at these things, again, getting back to that nervous system control, get it checked. And so when we look at things, one of the biggest things, let's see if I can get this banner to roll. When we look at things, number 1, that's first step. Number 2 is to ask yourself, are you living to eat, or are you eating to live? And what's the basis of your nutrition? Is it just whatever fad thing it is to lose weight, or is it building health? Are you giving yourself this model that says that the only thing that consistently over the ages has worked is live foods, being on a diet or a nutritional plan would be better, right? That is based out of whole food, fresh, organic is best, and then lean, healthy proteins. Are you? Nuts and seeds, things like this. Are you varying your diet? Are you making sure to rotate things throughout and not mono eat? And are you looking to do this fresh is best? If not, then you know what? It's not going to last, and it's not going to be sustainable. And so number 3, it's about getting back to getting involved with people who are exercising. And, anything's better than nothing. One of the studies that I've been reading lately is this, all over the place, is that it's not just about if you exercise during the day and you get your 30 minutes of high intensity cardiovascular exercise. And it's about the fact that you have to have a certain number of steps. You have to be moving a certain amount. You have to be on your feet a certain amount of time in or over and above that. And this is the biggest thing. And that's why sitting is the new smoking. That's why it's such a negative, is because so many people are staying so sedentary, and they might still be getting out and getting their 30 minutes to an hour of exercise, but it does not overcome the vast amount of time that they spend in a sedentary lifestyle, period. And so that's one of the biggest things, and are you thinking about those, and are you planning these things, and are you getting out with the kids after work? Are you getting your workouts in before work or after work? What are you doing to get this over and above? Not from the standpoint of I have to, this mentality of, well, I got to go work out, and man, I just have to be healthy. Such a burden. They should have just come up with a pill that, I just take it and I'm Arnold Schwarzenegger. And then, I take it, and, I'm perfect diet is all in this little pill. It's never going to happen, folks. We have to get over the Jetsons mentality that says that eventually the same thing will be freeze dried and zip it up in a microwave or whatever. Haven't we been trying that for a while? And we understand that it hasn't worked, and it's not going to work. And so we have to get back to the principles of health that say that a better lifestyle and better functioning body is always better across the board. And yes, I'm speaking to you, the staff, the people involved in our school system. I'm trying to challenge you the most because I want to keep my kids' schools open. I care about you as people. I want you to have healthy lives. I want you to be in the institution that is ingraining these principles of building health instead of fighting disease. And I want these people to be the healthiest people. I want you to be the model to which our children are growing up seeing what's the difference between the irregular world and then our population of teachers who are trying to teach us to grow up and have knowledge and use knowledge to the benefit of our lives. And so it benefits me to keep you, that educational population, the healthiest. Why? So that you can be the example to the next generation. You're right there in front of them. You're what they're seeing every day. And so if we can keep you healthy and get you healthier and keep schools open, then we create this model that will say, yes, America, we can do this. This is the way we're going to grow up our children. And it's through the 5 essentials. And so as we move from exercise and overcoming, we've got to get our steps in. We have to get our amount of exercise in. We have to understand that there's a certain amount of toxicity that the body is coming in contact with from the air we breathe and the water we drink and the foods and the fact that there's 10,000 chemicals used in the processing and packaging of our food. 10,000, folks. 3,000 just in the preservation of our food. Additives and preservatives, colorings. Ugh. It's terrible. That many chemicals we're dealing with just from food, right? And so there's this toxicity that we have to help get rid of. Sweating helps get rid of it. Breathing heavy helps get rid of it. And then taking less in helps you not have to get rid of it. And so when we focus on these things and we make these the conversations and we say to ourselves, we have time. This will be around. Viruses have been around, and the virus that we're dealing with now is probably going to be around in some way, shape, or form. And so we, in the future, for months or years or a lifetime. And so how are we going to make the population healthier so that there is less of a breeding ground instead of waiting to artificially, and this is the reason I disagree with vaccine, and I'm not going to stay on this long, but I disagree with waiting for something to be artificially injected along with God only knows how much formaldehyde, aluminum hydroxide, and other adjuvants that are meant to elicit the danger response that we don't know the ramifications thereof, but yet we do know that there's a separate vaccine injury court, and you can look that up and how many billions of dollars they've paid out. But yet when we look at this and we say to ourselves, that's again building the mentality that says I'm waiting for something outside of me to come in and save me, instead of building me up so that my terrain, my body is healthier and I don't have to worry because I know I invested in myself and I know I invested in the principle of health, in building health instead of fighting disease. And so ask yourself, what are your principles? What are you going to do with yourself? How are you going to vote? All right. This is Health Second Opinion. Dr. Chad McDill, helping bring life, liberty, and the pursuit of happiness and health to anyone who will watch. Hope to see you back here next week, back to school, healthy, happy, and safe.